If you've ever had a root canal or really any other major dental work, there's a good chance you left with an antibiotic prescription.
That's right. As 11 Alive senior investigator Rebecca Lindstrom reports, one of those drugs can trigger serious, if not deadly, consequences.
Your friends start to disappear, and you're in the house all the time.
Mary TLV thought she was doing everything right. After complications from a root canal, her dentist gave her medication to prevent an infection.
So it was clindamycin that did it.
She says what her dentist didn't tell her is that clindamycin carries a black box warning.
I'm sorry, I don't know what that means.
It means the risk of a dangerous and even deadly side effect is so high that for the past 40 years, the Food and Drug Administration has warned doctors to think hard before writing that prescription.
They should have checked. Do you have any problems with antibiotics, any digestive issues, that kind of thing? Nobody asked me.
Bacteria from your mouth can travel anywhere in your body, so there are times dentists prescribe antibiotics after oral surgery. Clindamycin was once the drug of choice for those allergic to penicillin. But we now know that powerful medication can mess with a healthy gut, unleashing something else, Clostridioides difficile, or C. diff.
Nobody wants C. diff. I'm telling you, nobody wants this.
In serious cases, C. diff bacteria releases toxins that can quickly destroy the lining of your intestines.
The pain that I was having and the bathroom issues.
The Centers for Disease Control and Prevention says about 250,000 people get C. diff every year. 15,000 of those will die.
Very small sliver, 10% of providers, of dentists across the state account for over 50%, I think it's 57% of all clindamycin prescribing.
Georgia Tech researchers working with the Department of Public Health dug into insurance claims to find out how often dentists were prescribing clindamycin as a prevention tool.
The good news is the rate from about 2019 to now, or at least through 2024, of clindamycin prescribing went down.
Even on the decline, more than 3,000 prescriptions were filled by dental patients in Georgia in 2024. Most of those over the age of 65.
I think doctors, dentists, surgeons, they all need to be re-educated.
11 Alive Investigates reached out to some of the top prescribing dentists. None of them returned our calls. Our analysis of another data set, Medicare claims, shows Georgia is one of the top 10 states for prescriptions. TLV says dentists prescribed it for her not once, but twice.
Didn't think anything about taking an antibiotic because I trust that dentist or doctor knows what they're doing.
For TLV, the health effects from taking clindamycin have been life-changing, and years later, ongoing.
You lose your confidence, you lose your life pretty much. Your social life is gone, your health is gone. It's a nightmare.
TLV says patients need to do what some dentists won't. Think twice. Ask if you really need such a strong antibiotic and understand the risks if you do. In Atlanta, Rebecca Lindstrom, 11 Alive Investigates.
So many of our investigations begin with tips from you. So if you have something that you want Rebecca to investigate, you can call us at 404-873-9111. You can also email us at investigates@11alive.com.